Welcome to the first session in the webinar series, Applying Best Practices to Diverse Older Adults, sponsored by the Stanford Geriatric Education Center in collaboration with the California Area Health Education Centers, American Geriatrics Society, and Natividad Medical Center. My name is Christopher Matola, and I will be your host for the session. We are very happy to have you join with us today as we present the program on Best Practices in Health Education and Nutrition for Diverse Older Patients with Diabetes. If you have questions during the presentation, please use the chat feature on the screen to write them. The presenters will respond to the questions in the Q&A session at the end of their presentations. If you need to communicate with the presenters directly after the session, you may do so by sending an email to Stanford GEC at stanfordgec@stanford.edu. At the conclusion of the webinar, please complete the short evaluation questionnaire. For those of you who have requested continuing education credits for attending the webinar, the evaluation is required. We need to let you know that the webinar is not supported by any commercial interest, and today's presenters have no financial relationships to disclose. And now, to introduce our new 2012 webinar series is our Stanford Geriatric Education Center webinar coordinator, Dr. Kala Mehta.
On behalf of the Stanford Geriatric Education Center and our partners, the American Geriatric Society, the California Area Health Education Centers, and Natividad Medical Center, welcome to our first webinar series devoted to best practices in the care of diverse older adults. Our focus today is on diabetes. Here at Stanford, we are fortunate to have Hal Holman and Kate Lorig, who, together with Ed Wagner in Seattle, helped to develop the evidence-based best practice in caring for patients with chronic illness. As you may recall, in Wagner's chronic care model, depicted here, the best practice includes a prepared, proactive practice team. Today, we present some tools that your teams can use with ethnic elders diagnosed with diabetes. I am very pleased to introduce my colleagues, Leticia Mendoza and Carolyn Fee. Leticia Mendoza is currently the Senior Diabetes Clinical Nurse Specialist and Clinical Diabetes Educator at Stanford Hospital and Clinics, and she's the go-to person for our difficult diabetic patients. After being a bedside nurse in the cardiac ICU for 5 years, in 2009, she received a Master's of Science in Advanced Community and International Nursing, and she plans to get her PhD. Carolyn H. Fee has taught at San Jose State University for 21 years. Her area of specialization are multicultural health, geriatric nutrition, and health promotion. She has been a valued colleague here at the Stanford GEC since 1992. After Ms. Mendoza's and Dr. Fee's presentations, Dr. Nancy Morioka Douglas, Clinical Professor of Family Medicine and Co-Director of the SGEC, will be joining us to help answer any questions. I will now turn the microphone to our first speaker, Ms. Mendoza.
Hi, good afternoon, and thank you for joining us today, learning more about geriatric patients with diabetes. Thank you to Dr. Morioka Douglas and all staff at SGEC for organizing the 2012 webinar series. Today's learning objective